Hey there, health enthusiasts! In today's video, we're diving deep into the world of dietary supplements for weight loss. We'll be examining the most common ingredients found in these products, including caffeine, green tea extract, green coffee bean extract, glucomannan, and capsaicinoids. We'll explore how they work, what the science says about their effectiveness, and any potential side effects or safety concerns you should be aware of. By the end of this video, you'll have a comprehensive understanding of the current state of research on these popular weight loss supplements. So, let's get started. Caffeine is a central nervous system stimulant that's commonly found in weight loss supplements. According to a meta-analysis by Dietary and colleagues published in Critical Reviews in Food Science and Nutrition in 2019, caffeine intake significantly reduced body weight, BMI, and body fat compared to placebo. The study also noted that the optimal dose for weight loss appears to be 400 to 500 milligrams per day, which is roughly equivalent to 5 cups of coffee. However, it's important to consider the safety aspects of caffeine consumption. While moderate intake of caffeine, up to 400 milligrams per day, is generally considered safe for most adults, higher doses may lead to adverse effects. A systematic review by Wyckoff and colleagues, published in Food and Chemical Toxicology in 2017, highlighted that excessive caffeine intake can cause insomnia, anxiety, digestive issues, and increased heart rate. Pregnant women, adolescents, and individuals with certain medical conditions should limit their caffeine intake. It's crucial to monitor your total caffeine intake from all sources, including supplements, to avoid exceeding the recommended limits. Next up, we have green tea extract, or GTE, which is derived from the leaves of Camellia sinensis. The active compounds in GTE are catechins, particularly epigallocatechin gallate, or EGCG, which have been shown to increase energy expenditure and fat oxidation. A Cochrane systematic review by Jurgens and colleagues, published in 2012, concluded that green tea preparations containing catechins and caffeine led to a small but statistically significant reduction in body weight and maintenance of weight loss. The exact mechanisms behind the weight loss effects of GTE are not fully understood but may involve the inhibition of lipogenesis, increased thermogenesis, and the modulation of appetite-regulating hormones. The optimal dose of EGCG for weight loss is considered to be around 400 to 500 milligrams per day, which is equivalent to about 5 cups of green tea, as reported by Hu Yu and colleagues in a systematic review published in Regulatory Toxicology and Pharmacology in 2018. Regarding safety, GTE is generally well tolerated when consumed in moderate amounts. However, the same review by Hu and colleagues noted that high doses of EGCG, above 800 milligrams per day, have been associated with liver toxicity in rare cases. People with pre-existing liver conditions or those taking medications metabolized by the liver should exercise caution when consuming GTE supplements. Moving on to green coffee bean extract, or GCBE, which is derived from unroasted coffee beans. The primary active compound in GCBE is chlorogenic acid, which is thought to reduce carbohydrate absorption and increase fat metabolism. A meta-analysis by Onakpoya and colleagues, published in 2011, found that GCBE supplementation led to a modest reduction in body weight compared to placebo, with an average weight loss of 2.47 kilograms. However, the quality of the studies included in the meta-analysis was poor, with small sample sizes and short durations. More recent, well-designed trials have yielded mixed results, with some showing no significant effect of GCB on weight loss, as reported by Roshan and colleagues in a randomized controlled trial published in 2018. The optimal dose of chlorogenic acid for weight loss is not well established, but most studies have used doses ranging from 180 to 400 milligrams per day. GCBE appears to be safe and well tolerated in healthy individuals at the doses typically used in supplements. However, as with any supplement, it's essential to consult with a healthcare professional before starting use, especially if you have pre-existing medical conditions or are taking medications. Glucomannan is a soluble dietary fiber derived from the root of the konjac plant. It's often included in weight loss supplements due to its ability to promote satiety and reduce calorie intake. When consumed, glucomannan absorbs water and forms a viscous gel in the stomach, which delays gastric emptying and increases feelings of fullness. A systematic review and meta-analysis by Onakpoya and colleagues, published in the Journal of the American College of Nutrition in 2014, found that glucomannan supplementation led to a small but statistically significant reduction in body weight compared to placebo, with an average weight loss of 0.79 kilograms over 8 weeks. The study also noted improvements in total cholesterol, LDL cholesterol, and triglyceride levels, suggesting potential benefits for metabolic health. The optimal dose of glucomannan for weight loss appears to be around 3 grams per day, taken in divided doses before meals. It's essential to consume glucomannan with sufficient water to prevent digestive issues such as bloating, flatulence, and abdominal discomfort. In rare cases, glucomannan has been associated with esophageal obstruction when taken without adequate fluid intake, as reported by Van der Beek and colleagues in a case report published in 2007. Finally, let's talk about capsaicinoids and capsaicinoids, which are compounds found in chili peppers and sweet peppers, respectively. They've been investigated for their potential weight loss effects due to their ability to increase energy expenditure and fat oxidation. Capsaicinoids, particularly capsaicin, are responsible for the pungent sensation associated with chili peppers, while capsaicinoids are non-pungent analogues. A meta-analysis by Whiting and colleagues, published in 2014, found that capsaicinoid and capsaicinoid supplementation led to a small but statistically significant increase in energy expenditure, about 50 kilocalories per day, and fat oxidation around 6 g per day compared to placebo. However, the effects on body weight were not significant, possibly due to the short duration of the studies, which ranged from 2 to 12 weeks, and the small sample sizes. The optimal dose of capsaicinoids for weight loss is not well established, but most studies have used doses ranging from 2 to 10 milligrams per day. Capsaicinoids are generally well tolerated, but some individuals may experience gastrointestinal discomfort, such as burning sensations in the mouth and stomach, at higher doses. While dietary supplements for weight loss are often marketed as safe and natural alternatives to prescription medications, it's essential to consider the potential risks and side effects associated with their use. The safety of weight loss supplements has been a topic of concern, with some products linked to serious adverse events and even death, as highlighted by Dwyer and colleagues in a review published in 2018. The most common side effects reported with weight loss supplements are mild gastrointestinal symptoms, such as nausea, diarrhea, constipation, and abdominal discomfort. These side effects are often related to the high doses of stimulants, like caffeine, or fiber, like glucomannan, found in some products. In most cases, these symptoms are transient and resolve with continued use or dose adjustment. However, more serious adverse events have been reported with certain ingredients. For example, high doses of green tea extract have been linked to liver toxicity in rare cases, particularly in individuals with pre-existing liver conditions, as noted by Hu and colleagues in their 2018 systematic review. Synephrine, a compound found in bitter orange, has been associated with cardiovascular events such as hypertension, myocardial infarction, and stroke when used in combination with caffeine, according to a review by Stoes and colleagues published in 2012. The long-term safety of many weight loss supplements has not been established, as most studies are short-term, less than 12 weeks, and have small sample sizes. There is a need for more rigorous, long-term safety data to fully understand the potential risks associated with prolonged use of these products. Another concern is the potential for interactions between weight loss supplements and medications. Many supplements contain ingredients that can alter the metabolism or effectiveness of certain drugs, leading to adverse effects or treatment failure, as reported by Asher and colleagues in a review published in 2017. For example, green tea extract may interact with beta blockers, antidepressants, and blood thinners, while glucomannan may reduce the absorption of oral medications when taken simultaneously. To minimize the risk of adverse effects and interactions, it's crucial for individuals to consult with a healthcare professional before starting any weight loss supplement, especially if they have pre-existing medical conditions or are taking medications. It's also essential to follow the recommended dosage instructions and not exceed the suggested intake levels. Despite the popularity of dietary supplements for weight loss, the evidence supporting their effectiveness is often limited and inconsistent. Many studies have methodological limitations such as small sample sizes, short durations, and lack of long-term follow-up, making it difficult to draw firm conclusions about the efficacy of these products. A systematic review by Onakpoya and colleagues, published in 2011, evaluated the evidence for various weight loss supplements, including green tea extract, conjugated linoleic acid, and chromium. The authors found that while some supplements led to statistically significant weight loss compared to placebo, the magnitude of the effect was small, less than 2 kilograms, and of questionable clinical relevance. The review also noted the poor quality of many studies and the need for more rigorous, long-term trials. Similarly, a meta-analysis by Jurgens and colleagues, published in 2012, examined the effectiveness of green tea preparations for weight loss and weight maintenance. While the analysis found a small but statistically significant reduction in body weight and BMI compared to placebo, the authors cautioned that the clinical significance of the effect was modest and that the quality of the evidence was low. One of the challenges in evaluating the effectiveness of weight loss supplements is the heterogeneity of the products and study designs. Supplements often contain multiple ingredients with varying doses, making it difficult to attribute effects to specific components. Additionally, the baseline characteristics of study participants, such as age, sex, BMI, and comorbidities, can influence the response to supplementation. Another issue is the potential for publication bias, where studies with positive results are more likely to be published than those with negative or null findings. This bias can lead to an overestimation of the effectiveness of weight loss supplements in the published literature. It's also important to consider the role of industry funding in the research on weight loss supplements. Many studies are sponsored by supplement manufacturers, which may introduce bias in the design, conduct, and reporting of the trials. Independent, third-party research is needed to provide unbiased assessments of the effectiveness of these products. Overall, while some dietary supplements may lead to modest weight loss in the short term, the long-term effectiveness and sustainability of these effects remain uncertain. The evidence suggests that supplements should not be relied upon as a sole strategy for weight management, and that lifestyle modifications, such as a balanced diet and regular physical activity, are essential for achieving and maintaining a healthy weight. In addition to their potential effects on body weight, some dietary supplements have been investigated for their impact on metabolic health markers, such as blood glucose, lipid profiles, and blood pressure. Improving these markers can have important implications for reducing the risk of chronic diseases, such as type 2 diabetes and cardiovascular disease, as noted by Golzarand and colleagues in a review published in 2018. Green tea extract has been one of the most studied supplements in this regard. A meta-analysis by Zheng and colleagues, published in 2013, found that green tea consumption significantly reduced fasting blood glucose and hemoglobin, A1C levels, in individuals with and without diabetes. The analysis also noted improvements in total cholesterol, LDL cholesterol, and blood pressure, suggesting potential benefits for cardiovascular health. Similarly, a systematic review by Onakpoya and colleagues, published in 2014, examined the effects of glucomannan supplementation on metabolic health markers. The review found significant reductions in fasting blood glucose, total cholesterol, LDL cholesterol, and triglycerides compared to placebo, although the effects on blood pressure were not significant. Chromium, a mineral often included in weight loss supplements, has been studied for its potential effects on glucose metabolism and insulin sensitivity. A meta-analysis by Hua and colleagues, published in 2012, found that chromium supplementation significantly improved glycemic control in individuals with diabetes, as evidenced by reductions in fasting blood glucose and hemoglobin A1C levels. However, the effects on lipid profiles and blood pressure were not significant. While these findings suggest potential metabolic health benefits of certain weight loss supplements, it's important to interpret the results with caution. Many of the studies have limitations, such as small sample sizes, short durations, and lack of long-term follow-up. Additionally, the optimal doses and formulations of these supplements for metabolic health effects have not been established. More research is needed to fully understand the long-term impact of weight loss supplements on metabolic health markers and disease risk. It's also important to consider the potential interactions between supplements and medications used to manage metabolic conditions, such as insulin and oral hypoglycemic agents. As with weight loss, lifestyle modifications, such as a healthy diet and regular physical activity, remain the cornerstone of metabolic health management. Dietary supplements should be used judiciously and under the guidance of a healthcare professional as part of a comprehensive approach to optimizing metabolic health. In conclusion, the popularity of dietary supplements for weight loss has soared in recent decades, driven by the increasing prevalence of obesity and the desire for quick, easy solutions. However, the evidence supporting the safety and effectiveness of these products is often limited and inconsistent. While some supplements, such as green tea extract, glucomannan, and caffeine, have shown modest benefits for weight loss and metabolic health in short-term studies, the long-term sustainability and clinical relevance of these effects remain uncertain. It's crucial for consumers to approach weight loss supplements with caution and realistic expectations. These products are not a magic bullet for obesity and should not be relied upon as the sole strategy for weight management. The most effective approach to achieving and maintaining a healthy weight is through a combination of a balanced diet, regular physical activity, and other lifestyle modifications. Dietary supplements, if used, should be considered as an adjunct to these foundational strategies rather than a replacement. When considering the use of weight loss supplements, it's essential to prioritize safety and consult with a healthcare professional. Some supplements have been associated with adverse effects, particularly when taken in high doses or combined with other substances. Interactions with medications and pre-existing health conditions are also a concern. By working closely with a qualified healthcare provider, individuals can make informed decisions about the potential risks and benefits of specific supplements in the context of their unique health status and goals. Ultimately, more research is needed to fully understand the long-term safety and effectiveness of dietary supplements for weight loss. Well-designed, independently funded clinical trials with larger sample sizes and longer durations are essential to provide definitive answers. In the meantime, prioritizing evidence-based lifestyle habits and seeking guidance from healthcare professionals remain the most prudent approaches to managing weight and optimizing overall health. That's all for today's video on dietary supplements for weight loss. We hope you found this information helpful and informative. If you're interested in learning more about nutrition and health, be sure to visit nutritionmarket.com.au. There you can find a wide range of high-quality supplements and access our virtual clinic, where our team of clinical nutritionists and naturopaths serve clients in Australia and around the world. Book a consultation today to get personalised advice tailored to your unique health needs and goals. Remember, while the research we discussed today is promising, it's important to keep in mind that supplements should not replace a balanced diet, regular physical activity, and guidance from healthcare professionals. Some of the findings presented are still under investigation, and individual results may vary. If you found this video valuable, please hit the like button and subscribe to our channel for more content on nutrition, health, and wellness. And don't forget to share this video with anyone who might benefit from this information. As always, this video is for informational purposes only and should not be considered medical advice. Consult with your healthcare provider before making any changes to your diet, exercise routine, or supplement regimen. Thanks for watching, and we'll see you next time.